airmen have swabbed over 11,000 symptomatic citizens from these two parishes. And we have more medics supporting other medical testing sites throughout Louisiana. The 225th Engineer Brigade has worked with the State Fire Marshal's Office, the Louisiana Department of Health, and the Corps of Engineers conducting engineer assessments of facilities throughout Louisiana. These assessments were done to identify possible locations that would be used to increase medical surge capacity for the state. This collaborative effort by all stakeholders resulted in over 70 assessments, some of which were chosen for construction or remodeling. Our civil support team's expertise has been leveraged as well. The CST has gone out to each of the medical testing sites to train our medics on effective utilization of PPE prior to the site's opening, and once open, provide quality control and assurance at these sites. Additionally, the CST has provided training on donning and doffing PPE cross-contamination training for several state agencies throughout Louisiana for the past couple of weeks. This was accomplished with large groups using virtual technology. I also want to take a moment to highlight the tremendous collaborative effort in New Orleans. New Orleans is the site of a historic dual-status command where a National Guard one-star general is the commander of a force comprised of National Guard and active duty forces. Working together, we have converted the Morial Convention Center into a medical surge facility, set up an incident command center, and significantly increased the medical capabilities of New Orleans. A final thought. It is easy to get immersed and consumed by this response. I urge everyone to find something else to do throughout the day when time permits, whether it's exercise, reading, gaming, watching a movie, or working in the garden. Do something else to clear your mind and body. We all need to stay fresh for the duration of this incident. I want to personally thank General Lengyel for this opportunity to tell our story. I also want to thank all of you for helping to keep people informed. Our motto in the Louisiana National Guard is protect what matters. And I would urge all of you to stay safe, stay healthy, and stay #in this together. Thanks for your time today, and I hope each of you have a great day. And with that, does anyone have any questions?
Gentlemen, we have several journalists here in the Pentagon briefing room, so we'll start here with Jennifer.
Thank you both for doing this. It's Jennifer Griffin from Fox News. General Lengyel, can you talk a little bit about why there are still such small numbers of people being treated both at the Javits Center and on the Comfort? Is there a bureaucratic holdup to getting patients sent to those locations? They seem underutilized in a place that is overwhelmed. And General Waddell, can you talk about how many testing sites are there? You were talking about the drive-through testing sites in Louisiana. And what are your frustrations? What do you need? What are you seeing on the ground, since Louisiana, after New York, is one of the top hotspots in the country?
Hey, Jennifer, General Lengyel here. Thanks for the question. You know, I know that the Javits Center is up and running. It's staffed with people, and they're prepared to take patients across the spectrum from COVID positives to the full array of people that need treatment. So as to why there's such a small number of folks in there, I really can't tell you how they're getting vectored into the Javits Center, but I know that they have capacity and they are prepared to service people, whoever shows up and needs medical care. Over.
And for Louisiana, we are working 7 testing sites, and I'm really not frustrated with anything. I think the federal, state, and local authorities that we're working alongside are all doing a phenomenal job, and we're pleased that we have an opportunity to support them. Over.
Let's go here to Tom.
General, for Lengyel, it's Tom Bowman with NPR. You mentioned that 28,400 guardsmen are deployed, but you also mentioned that a lot of the Guard medical personnel are still in their civilian jobs. Can you give us a percentage of how many of the 28,000 are actually medical personnel? And the other thing is, do you expect to call up more medical personnel as this thing continues? and also maybe shifting guardsmen to other states that may be in greater need?
So, of the 28,400, certainly some states have brought their National Guard medical capacity on duty to help them respond. I think if you keep in mind the kind of medical capacity that we have in the National Guard, it's generally not the kind of capacity that you need to run hospital kind of operations. The medical capacity that we have in the National Guard was built to sustain sort of predominantly combat operations in the battlefield, to get people from point of injury to sustain them till they actually get to a medical facility that is able to treat them for the longer term. Although we do have, we do have a good number of doctors and nurses and, physicians, assistants, and medical technicians that are engaged throughout the entire enterprise. I'll tell you, I was in Florida last week, and I saw that Florida was utilizing many of their medical technicians in the testing facilities in Miami. And they had doctors engaged there. They were helping to sort through people that may or may not need the COVID test and making those kinds of determinations. So, I think that across the U.S., we've known from the beginning that taking the capacity and mobilizing it, if you will, out of the reserve component and putting it into the military mechanism and moving it, there was a price to pay for that, because they are providing medical care to their communities and their civilian capacities as doctors and nurses and the like. And we have to keep in mind that there is still other medical issues going on. People still have cancer. People still need treatment. And to empty out the medical capacity, notwithstanding just what we're doing for COVID, provides also, an impact to the society. So I don't have a percentage for you. I can tell you that, we talk about the total medical capacity of Army and Air National Guard together is probably about, it's nearly 18 or 19,000 individuals, but that's broken down by a pretty small part of them are doctors and a small part are nurses, and then a large percentage are medical technicians and the like. So as the states grow and build these alternative care sites in their states, and we've been involved in many ways and are involved in many ways right now working with the Corps of Engineers to develop these sites. And, you talk about the three things that you need for these sites. You need the actual structure that is created so that you have the capacity, and then you need the supplies to make sure that it has all it needs to function, and then you need the staff. And in some cases, members of the National Guard from individual states are actually supplying that staff to these alternate care facilities. Some cases it's Title 10 inactive component or mobilized reservists that are doing that, a lot of that. And I think over time, the ability to move things from one state to another, whether it's whatever the other two S's, right, supplies and staff, some of that is already happening. We're moving ventilators, from states. You saw that Oregon is providing ventilators to New York. I know yesterday California shipped from some ventilators to New York and New Jersey as well. And as New York, we're still looking at New York as, what does this peak mean? Is it a sustained peak, or is there going to be some sort of a drawdown on the other side that makes supplies or staff available to go someplace else? I think that's one of the most stressing things on the hospital system has been the duration of this event, and the ability to see the impacts it's having on the staff as staff members itself become sick or become quarantined and can't be part of it, so that the staff themselves are getting tired. So, as this event moves around the country, while we aren't sure exactly what's going to happen, we anticipate that people will be able to share supplies and perhaps some staff as well. So that's how we're looking at this in the future.
Megan and Ryan will go to the phones after that.
This question is for General Lengyel. There are about 250 right now guardsmen who've been diagnosed with COVID-19. Do you know how many of those are among the activated troops in the response?
So my numbers this morning were actually 349 National Guard members. I'm showing Army and Air that are COVID positive, and the actual numbers who are actually as a result of the response, I'll have to get that for you and take that for a follow-on. I know there have been some. I have talked again to some of the members in the Florida Guard who became ill as and whether or not they were infected as a result of doing testing or whether they were infected before they began the testing are things that obviously we don't know for sure. But I'll try and get those numbers out to you here in the next day or two.
Thanks.
Brian.
Thank you. This question for General Lengyel, please. You said that at the top that you expect the number to increase of guardsmen participating. How much do you? I mean, it's been ramping up fairly quickly. How much more could be done? Realistically, how big do you think it could get? And I have one follow-up.
So, I mentioned, I think in the middle of March, my first presser I did with you folks, someone said, how many will there be? And I said, I think there will be tens of thousands. And that particular day, I think we had just over 2,000 or 3,000 back in March 15th or 16th, and we were just kind of beginning the ramp up. I will tell you that right now, with all of the states who have declared major disaster declarations, and I think that number continues to grow. I'm looking at 31 states now included on the presidential memorandum, and I think there was another one that came in today that will add some more. 50 states have major disaster declarations. We're authorized now to bring on up to 44,000 total members of the National Guard covered under the 502F pay scenario, the Title 32 pay funding that we talked about in previous weeks, which gives them federal pay but state control, and now because those memorandums allow them to be covered for up to 31 days, they will have full insurance and full medical benefits. Keep in mind that states are being very deliberate about how they bring on their National Guard members. They all, as they worked with FEMA to decide how many they would ask FEMA to approve for them to bring on, they basically made some assumptions. And because of the issue itself, they're not bringing guardsmen to work until they have specific tasks and missions and things for them to do. And in some cases, states have been looking at timelines and assumptions on numbers of National Guard members they would need to do things, for instance, like testing at the drive-through testing sites or the community-based testing sites. And sometimes they had to sort of pause and wait for them to get the actual tests and the equipment to bring them online, or that in one case there was some holdup because they didn't have the PPE, the protective equipment that they needed to run those sites. So, they've been bringing them on only at time of need, so when they're there they can be put immediately to work and to use, and they don't unnecessarily gather in groups that could, perhaps perpetuate the virus itself. So, and they are doing social distancing and all of the protective measures that we can when you're involved in this. But what the final number is going to be, I really can't. We'll wait and see. All I can tell you is it's going to continue to go up. I think this week will be well over 30,000 in the next couple of days. We've been accelerating at sort of more than 1,000 a day. Last time we met, I think it was going up at just about 1,000 a day. It's been a little over that lately, and so we could easily get this up another 10 or more than that in the near next week or two. Over.
Thank you. And then the mayor of New York has called for additional military personnel to be sent to help treat some of the cases in New York. Have any Guard kind of gone from one? I know in hurricanes they'll often, neighboring states will kind of support. Has that occurred at all here, where you've had kind of cross-state Guard forces supporting some of the harder hit areas?
So, we call that the Emergency Mutual Assistance Compacts that they do state to state, where they share their resources state to state. And to my knowledge, in this pandemic response, there has not been. I don't think that there has been any really direct requests from one state to another. The predominance of medical capacity that has been flowing into New York, over and above what's resident in New York, in the New York National Guard, there has been from the Title 10 and the active component services, Army, Navy, Air Force, Marine Corps, and the like. So to my end, this is a different sort of emergency where states are concerned about the widespread nature of this as it goes. But I do think, and my staff here at the National Guard Bureau has kind of looked at this holistic scenario, and as this progresses and as states pass their peak areas and begin to decline, I do think that it's possible that states could share not just equipment but also people.
Let's go to the phones. Paul Son, Washington Post.
General Lengyel, thanks for doing this. I was wondering if you could give a few more details about what the Guard is doing specifically in New York City and how those operations have changed as we have seen the hospitalizations and the deaths now their peak, and what you're kind of expecting there going forward.
Yeah, so New York City obviously was the first major hot zone and the first. They ramped up similarly in numbers with Florida in terms of the time and pace at which they brought National Guard members on. So, New York has done a lot of things in conjunction, I mentioned earlier in my remarks, with the Corps of Engineers in terms of setting up the additional medical capacity. We really haven't been involved in the Comfort. The Comfort as a separate hospital ship entity has pretty much been a Title 10, but there's really no National Guard involvement, to my knowledge, with the Comfort and that ship capacity. But in many ways, we've been involved with the Javits facility and how that has been up there. We have been involved in, the everyday transportation systems. New York City, they had call centers for people to come in and do information call center activities so people can find out where test sites were. The New York National Guard, I mentioned, has been directly involved in the test sites in New York State. They've been involved and continue to be involved in, unfortunately, in mortuary affairs, where we have the city of New York, the Adjutant General, the Major General Ray Shields, reported that in general, on a normal non-COVID sort of a day, maybe 25 people need to be removed from homes where they have passed away, and those numbers are up significantly, and 150 people a day are needing to be taken via mortuary affairs, and we're concerned. We have some National Guard units that are trained to do this so that people can be, human remains treated with dignity and respect. And we're not just doing that as Guard. That's also a mission taken on and assisted by with the active component as well. So, there's really logistics, communication, transportation, all of the things that we do. New York is also involved in food banks and the distribution of food throughout New York City as required by the city. So, I think that in many ways, anything the city of New York needs us to do, not just specifically medically related to the event, but we're doing some of that as well. As this event has taken on, the New York National Guard has done it. And I'm looking at New York's numbers today. They're at about just over 2,500 National Guard members on duty, and that's going up to over 3,000 by the end of the week.
Let's go to Tara Kopp from McClatchy.
Hey, thank you for doing this. General Lengyel, a couple of weeks ago when we were really early into this, I'd asked about hurricane season planning. And now that there's so many National Guard deployed and you're expecting even more, have you guys had another thought at how hurricane season will be handled, especially now that there's some predictions that this could be a heavy hurricane season?
So we always plan on a heavy hurricane season. And, we in fact are looking at implications of what it might be like to have to do a hurricane response in a COVID environment. We're obviously hopeful that by hurricane season, which starts in June, obviously we're hopeful that this begins to lull at some point there. But the staff is looking at what would be different and how would we have to react, from a hurricane system. And there's a lot of things that are involved in that. Not only do we have to do the normal things that we do in every hurricane, I think the economic impact of some of the states and their ability to respond. Normally hurricanes respond pretty much predominantly funded by the states, and unless it's a bad one, then it's a Stafford Act and it gets augmented there. But this kind of response we're doing now, and as the federally funded National Guard, state controlled, usually isn't available to states for domestic kind of hurricane response activities. So yeah, as always, we're thinking about how to do that. We're getting much better as a staff using IT and video teleconferences and communications. So prior to this year, predominantly we'd have to get together and have our planning conferences. Our staffs are actively thinking and doing planning for hurricane season as we speak.
Let's go to Jeff Schogel, Task and Purpose.
Thank you. General Lengyel, you mentioned that now National Guardsmen can receive full insurance using TRICARE and a basic housing allowance. Can you talk about why they weren't put on 31-day increments to begin with, in which they would have qualified for these benefits?
Yeah, I think that originally this came out, and FEMA generally gives shorter duration mission assignments, as in normally, 2 weeks is a normal mission assignment. I think we in the National Guard Bureau and in the Department of Defense saw that this would be an enduring sort of event that clearly is going to go past into May and maybe beyond. So I think I think that FEMA was restricted to writing the mission assignments to what was authorized in the presidential memorandum, and I don't want to speculate on why they chose 30 days. But the difference between 30 and 31 is significant for the men and women who are actually, I use the term mobilized. Many of these women in the National Guard, they are volunteers, but their governors have called them to duty. And so they really, the governors can make them go work testing sites and make them go work in the Javits Center and the like. So, having them with the full benefits of the other reservists, the federally mobilized reservists who are helping on the comfort and helping in the field medical hospitals, they're mobilized under a different authority for longer than 30 days, and they all have full benefits for insurance and leave and BAH and the like. So getting it over 31 was a positive thing, and it makes the mobilized National Guard members who are on duty in the states receive the same benefits as the federally mobilized members who are also assisting in the response. But as to why they exactly wrote it at 30 days, I don't really know the answer to that question. We recommended a longer period of time at the beginning.
So let's very quickly get in a couple of more here. Laura Seligman, Politico.
Hi, Sarah. Thanks for doing this. I'm wondering if you could tell me if there's been any impact from the decision to reprogram the funding from the National Guard to build the border wall on the efforts so far with regards to COVID.
Yeah, no, I can tell you that there's been no direct impact on COVID, our ability to respond based on reprogramming funds to the southwest border. You could draw some line to it that, some of our funds that we buy equipment with, and that equipment could be PPE or it could be response sort of things, usually comes, particularly on the Army Guard side, out of our INGRIA funds. But to think that the money that they just moved, would have had PPE available for this response, I think would be unfair. That wouldn't be true. We would not have had increased response capability had we not reprogrammed the money.
Let's go to Sylvie from AFP.
Hello, General. Thank you. Well, it's exactly the question I wanted to ask you, because last time we spoke, you said you had enough PPE, and today you said that in some cases the National Guard didn't have the PPE they needed. So I don't understand who is providing these protective equipment. Is it the Pentagon or the states?
So, it's sort of a combination of both. I mean, I would tell you that some states, and when I was in Florida, let me answer your first question here first about, why would I have said we had enough? I think, 3 weeks ago or so when we spoke, there were a lot less testing sites up. There were, they had only established testing sites in some number of states, and this event has been growing, for weeks. So as it grew and new states decided that they wanted to bring on more testing capacity, there became sort of an increased demand on the original, draw or the original supply of the PPE. Well, originally when I talked to you about, 2 or 3 weeks ago that everybody had it at their sites where they were working it, that was true. And nobody is doing any testing right now without the appropriate PPE as they're ongoing. But there have been cases where they said they have to delay the opening of their sites until they had the PPE. But those situations are still sort of ongoing. And then as to where it comes from, I think that what I've learned is at the testing sites, some of the test kits and the sites are state funded and state supplied, and some are federally funded and federally supplied. So FEMA supplies some of the PPE, and in some cases the state medical apparatus is supplying the PPE. So, at the point of the incident, there's generally more than one source of where it's coming from, and they're having to share between state and federally provided equipment. So I hope that makes sense.
Let's go to Richard Sisk at military.com. Richard, are you there? Okay, let's go to Sidney Friedberg at Breaking Defense.
Generals, thanks very much. A two-pronged question for both of you. First of all, of the 28,400, are those all folks on Title 32? Is it a mix of state orders, Title 32, maybe even some Title 10? And second, as you mobilize people, you keep on mentioning you don't want to pull people who are needed in their community medical response. Do you actually have a way to check for that besides, calling into each individual? Is there some kind of guard database that tracks, these people are crucial for local law enforcement, these people are crucial for local medical care, so in, X emergency, don't call these guys up, and Y emergency, don't call these guys up?
Yeah, so first question is, the 28,400 is sort of a mix of statuses. Today we have almost 11,000 of those are on the 502F status, but that number is growing rapidly. There was some sand in the gears on making sure that we had the cost figures right, so that FEMA had the exact numbers so that we could pay the people in the states and actually make sure that they had the money to pay the people in the states. So we're working through some of those. And some states were kind of going slow putting their folks on the orders because they knew everybody was working pretty hard to get this over a 30-day length of time so that they could properly cut the orders and get people their insurance benefits and their basic allowance for housing benefits, and they wouldn't have to then break orders and recut them. So you're going to see that number in 502F increase rapidly. There is some that are still state active duty included in those numbers, and I'll mention that the state of Wisconsin, for instance, did their primary election. The governor brought on some members to help run that election yesterday, and those members were actually in state active duty. They weren't federally funded. And then there are still some, those numbers don't include any Title X really members that are in the staffs doing it. Those are all state active duty numbers or 502F numbers.
Let's go to Jennifer at Air Force Magazine. Pardon me.
Your other question was, I think it is sort of a family business, and some doctors have, more specialized skills than others. Many doctors, it is a phone call of can you come, and will this impact in many cases. Same thing with nurses. But I'll let General Waddell take a shot at that for how they did that in Louisiana.
Okay, so the answer to the first question, I guess, on the number of 1,300 plus that I gave, that was a combination of state active duty, our Title 32, and some of the Title 10 that we have on currently on duty. On the second part of the question, in Louisiana National Guard, we do have lists, and I'll use an example of a couple of them: a first responder pool, a medical community pool, and then we work closely with the individual as well as the other state agencies, and as long as we're communicating with one another to understand what requirements that they have in their civilian capacity, certainly we honor that, because what we don't want to do is, rob Peter to pay Paul in terms of taking a doctor or a nurse off the front line and bring them on a duty with us just to repurpose them. So, and students fall into that list too, college students. I know right now we have several of them that are on duty, but we do have a lot of those lists that we refer back to when we have different incidents here in Louisiana.
So let's go to Jennifer at Air Force Magazine.
Hello, sir. Thank you so much for taking the time. I also have a two-pronged question. The first is, as we are approaching the peak of the outbreak and with cases expected to max out that we've seen, what is the expected timeline along which you will have enough PPE if it is running short? And have any Guard members been instructed to reuse PPE like we've seen in tri-state area hospitals? And the second prong of the question is, since DOD has been releasing the numbers of COVID cases among military dependents, I was wondering if NGB is tracking that figure within its own ranks, because we've heard about the number of personnel infected, but I'm curious about whether any family members have been exposed. Thank you.
So the PPE question is, I think we're still tracking it very, very closely. I don't think I think that people are being smart with their PPE, and if they're able to reuse a mask, they're probably husbanding them and reusing them as they can. As far as timelines on when that all goes away, I do know that there's just massive amounts of PPE that we're trying to produce and buy and supply, and when this is over, we're going to have to build buildings to put the PPE in, and we'll make sure that we have the appropriate number. So as far as dependents go, when I look at our total numbers, I'm showing that not included in those 349, those are just National Guard members. But I'm showing we had 4 civilians and 3 contractors and 13 dependents were also showing, the numbers I have of showing positive. But, those numbers sound a little bit low to me, so I would suspect that those are just ones who have been tested, and that's what I'm showing right now.
And do you know what that data is as of?
I'm sorry that I don't know. I'm looking at my chart here from my staff on where they provided. I don't know the exact source of where that data came from.
Thank you.
And let's get last question here, Rose from Stars and Stripes.
Hey there, thank you. Last but not least, my question is around these the orders for Title 32 and federal funding and benefits for troops. Do you know, will we be able to see more of these troops get on the Title 32 status, or are we still going to see more and more state active duty as well? And then also, General Waddell, you might be able to talk about how getting the 31-day orders is helping as far as assigning troops and making sure that they're taken care of, and with your planning for them.
So I'll go first and say I do expect to see more on the federal funding side and 502F. It's it's not exactly easy for us to manage in terms of we're having to carefully manage this. Generally when you go into a war, and we're sort of treating this like a campaign, you have a build-up, and then you have the actual operation, and you have a drawdown at some point. You don't go into a campaign and say, okay, here's your 3,000 people, and you have 31 days, start today and end in 30 days. You do things that are based on a conditions-based environment, right? So you bring people on as you need them. You bring them on to prepare and to set the theater so that when things ramp up, you have what you need in order to operate. And then you operate, and then there's a similar drawdown piece of this thing, right? And so we're concerned about, hey, when people come off orders and off duty, there's going to be some quarantine period that probably should be covered by these orders as well on the back end of this before they can really go back to work or back to, and in some cases, probably not all cases, but some people will have been known, exposed, and around people with COVID that they won't be wanting to go right back into civilian jobs or economic activities. So, that's how we're trying to manage this so that we can bring it on. It's much more, it's not quite as flexible as we'd like it or need it to be. Over to General Waddell to talk about Louisiana.
Thank you, sir. Ma'am, we don't have anyone that's on 31-day orders currently. Certainly we're advocating and optimistic based upon the Chief's comments that it's coming. But please know that we always want what's best for our soldiers and airmen here in Louisiana and across Guard Nation. And, whatever we need to do on our part, we will. I know we do have a request in, and we put that request in for 31 days long ago. But, again, I'm optimistic that that's going to happen for the benefit of our soldiers and their families. Over.
This is Trace Garnier with Newsy. I have a follow-up.
Go ahead.
Yeah, I did as well.
Go ahead. Go ahead, Newsy.
And could I please get in one question? Richard Sisk, military.com.
There you are, Richard. Go ahead,
Okay.
Newsy, and then we'll follow up with Richard.
Great, thank you. It's a follow-up about the military health care coverage. Does this include National Guard's troops being seen by VA medical facilities? And if so, there are many facilities that are now seeing non-veterans that have COVID-19. So, for instance, in Michigan and Louisiana. And I've spoken to many veterans who were concerned that this will impact them receiving medical care. So what impact do you think this will have on the veteran community if VA facilities continue to open their doors to non-vets, which include National Guard's members?
Well, many National Guard members are vets, and so I think that, the TRICARE medical system is a large, big enterprise that leverages everything from military hospital facilities to civilian healthcare networks that do it. So it's really impossible for me to tell you exactly. I haven't heard of any degraded projected impacts on the veteran system here. I mean, in many places there are no military medical facilities, and all that's out there is available is civilian healthcare providers who take TRICARE. So once we get this transition on to 31 days, for the member and for their families, they'll enter into the TRICARE system. Many of who have been on this TRICARE system before, they have plugged in before as their members have been deployed. Don't forget, while we have 28,000 that are on duty doing COVID operations, we have about the same amount, just under 30,000, that are mobilized Title 10 around the world, that are in the Middle East and in the Pacific and doing other things. So we've got more than 60,000 members of the National Guard that are engaged today that are doing it. Many of them are already on TRICARE, and that is one of the one of the challenges, frankly, for the reservists and the National Guard is it's transitioning between providers, between whatever it is your civilian provided medical benefit is to the federal TRICARE provided medical benefit is. So it's just one of the challenges we learn how to deal with. And as we come on duty and as we become eligible for TRICARE, which is not a new thing for us, I've never heard of us overwhelming the Department of Defense or the VA medical system or the TRICARE medical system. So I hope that helps.
Richard, you were in there?
Yeah, thank you. General Lengyel, you mentioned at a previous briefing that several governors had inquired about the possibility of assistance from the Guard's fast support and recovery teams. Have any of them been activated? And sir, you mentioned earlier that there is some form of mortuary assistance being provided by the Guard now in New York City. And something about, a death toll of 150 a day. Are Guard members actually going into homes to take out deceased individuals? How is that functioning, sir?
So, the fatality search and recovery teams, the FSRTs, we do have a good number of those based around the country, and I think New York's team has actually been activated and is involved in that. My understanding, and keep in mind I haven't been to New York City to see it, but my understanding is that we are involved with New York City Emergency Response Network to assist the movement of deceased individuals. That not all of them are COVID related, obviously, but some certainly are. And we are doing some of that. I think Wisconsin has brought some members on their team as well, or they have thought about it, some other teams. So there is a capacity in the National Guard to deal with it, and we have used them and are using them now.
Thank you, sir.
I think there was one other person who wanted to get a quick question in.
Yeah, this is Rose. I had a follow-up.
Rose.
I just wanted to clarify, General Lengyel. You said that the 31-day orders aren't quite as flexible as you'd like them to be. Are you advocating to maybe extend those beyond that if possible?
Well, I think that it's unknown. Like I said earlier, this is a condition-based response that we're doing here, I think that having the ability to flexibly, we're limited, as I understand currently, from the date the president signs the memorandum to 31 days from that particular date. It'd be we're continuously working to make and adapt this system inside the department. Lots of people working hard on the OSD staff and at FEMA and on my staff to work with the White House and those that are crafting the kind of rules of the road as we deal with this. Ideally, we would like to be able to place people on 31-day orders, but start them and end them when it makes sense according to the mission. We don't want to have to bring all 3,000 on one day and end them 31 days later. It might make better sense to bring some of them on now and in 2 weeks bring some more on and let them all run for the 31-day period. But, we're still working through this, and lots of people are trying to do this. We haven't really done something like this before across the entire nation where we have had to do this. And so, we have called up large numbers of 502F people before. We did this for Hurricane Katrina. We had 50,000 people surrounding New Orleans and Mississippi during Hurricane Katrina, if we go back to the 2005-06 time frame, and that lasted for a couple of years. And it was all right there. We could do things that we talked about bring people from other states and capabilities from other states, and people would share them and bring them down to help the response in New Orleans at the time. This is a completely different scenario. This is a nationwide, simultaneous, dynamic situation that requires, the deliberate manipulation of the force. And as I said, you don't want to bring people in if you don't need them. But as conditions on the ground change and the mission changes, I heard this morning that there's lots of models out there, and they just give you a place to start and to plan from. They're all wrong. Nobody knows exactly what the right model is, but they give you a pretty good idea of where to go and what to look at. And so we've been following them, and we're planning bringing people on duty in concert with where we see what the predictions are for, the peak surge points for cases and needs for the National Guard, and we'll keep doing that. My point was 31 days for 31 specific days is a very inflexible way to use this. We need to be able to spread it out at point of need to bring people on and to bring people off, and have the term of duty be 31 days or longer.
There's one other person.
Yes, hi, General Lengyel. It's Jonathan from the New York Times. I was just wondering what you would say to some of your soldiers who are coming off temporary federal orders only to go back to state orders, and how to deal with the uncertainty about whether they'll get any points towards retirement or get access to health care.
So the first thing I would tell them is thank you. Thank you for what you do. Thank you for your service. That what you do for America, whether it's help fight wars or whether it's help deal with domestic crisis, they're a special kind of American people that all of our military members, not just the Guardsmen, that come and they do the right thing. And what I can tell them is that, across from the governors in their states, the adjutant generals in their states, the people here in the Pentagon are trying to make sure that they have the right resource with the right benefits to take care of them, and nobody's asking them to go and do anything where they're not appropriately protected or appropriately compensated. We haven't had to cut anybody off this federal funding yet. It's my hope that as this continues to go, we will be able to, make the case and show leaders in the White House and leaders in FEMA that, hey, these missions are conditions-based, and if people are forced to extend because this national crisis, this war on COVID, they're assisting us to get our nation up and running again and get the economy going again, bears the appropriate commitment in terms of resources to extend them the appropriate length of time on the appropriate resource, 502F, if that's the case. So we haven't had to terminate anybody yet, and so my hope is that if the need continues to be there, that I'm convinced that we'll do the right thing and we'll make sure that they're appropriately covered under the right status of orders.
Okay, I think you have some people coming off orders today who are pretty unsure about what the future holds, and they see their mission as being pretty open-ended and interminable, and they're getting anxious because they don't see this mission ending, yet they see great uncertainty in their status.
Well, specific to New York, Jonathan? Is this just specific to New York? Because
no, it's not.
Yeah. So I'm not sure. I mean, the first presidential memorandum I think came out on the 27th of March, and that was a 30-day authorization. So we haven't found a need yet, at least from our level, to terminate anybody's orders because they don't have the authorization to do it. I'm not sure. Now they could have. It is possible that somebody in the state could have reallocated them to some mission set that wasn't related or wasn't seen as a federal capacity here to deal with the COVID crisis. And if that was the case, and somebody said, "Hey, this isn't covered under the mission sets allocated by the FEMA mission assignment," then the governors would may want to continue to pay them on a state active duty status. But that hasn't been, I'm not aware of that yet.
If there are no other questions, we'll thank General Lengyel and General Waddell for being a part of the briefing today.
Hey, thanks, everybody. We'll see you again soon.
Thank you.
Thank you.
Thank you. Yes, thank you.
Thanks.